Thanks for staying tuned. Now let's look at the stories that made the headline within the week in the nation's capital.
The federal government has announced plans to withdraw a total of $150 million from the Sovereign Wealth Fund for distribution to the federal, state and local governments. The Minister of Finance, Budget and National Planning, Mrs. Zainab Ahmed, made the announcement at a media briefing.
Our experience shows that the monthly average PAC receipts should be at an average of at least 650 billion for the federal government and the state government to meet their current obligations in a healthy manner. Unfortunately, we project that monthly receipts may decline to as low as 400 billion over the next 3 to 6 months. To address these emerging fiscal risks, the President has approved that the sum of $150 million be withdrawn from the Nigerian Sovereign Investment Authority Stabilization Fund to support the June 2020 FAC disbursements. The Stabilization Fund was created for such emergencies and is to be utilized for this purpose.
In the meantime, the United Nations, in partnership with Nigeria, has launched a single basket fund for COVID-19 for the coordination of all donations from United Nations agencies. According to the United Nations Resident and Humanitarian Coordinator, the fund will also help to cushion the effects of the pandemic on the country's economy and the health sector.
The COVID-19 Basket Fund has been designed to serve within the One COVID financing and investment platform through which the different stakeholders, i.e. the United Nations, other multilateral and bilateral donors, as well as other key stakeholders, can channel their financial contribution to the multi-sectoral efforts of the Presidential Task Force on COVID-19 response.
The Presidential Task Force on COVID-19 says it will publish full details of donations to the nation's relief account and how it is used. The Secretary to the Government of the Federation, Mr. Boss Mustafa, who is the chairman of the task force, made the pledge at a news conference.
The Presidential Task Force, working in collaboration with the Accountant General of the Federation, have concluded and published details of accounts into which donations by well-meaning members of the society and corporate organizations can be channeled. I must emphasize that transparency and accountability shall remain the hallmark of all transactions under COVID-19 activities. The expansions of the infrastructure for treatment is important. However, private hospitals that have capacity to manage COVID-19 cases shall seek certification by the Committee of Infectious Disease Experts assembled by the Federal Ministry of Health for standardization and safety of frontline staff and other patients.
In the meantime, the leadership of the National Assembly met with members of the Presidential Task Force on COVID-19. The lawmakers had earlier raised concerns about the disbursement under the Social Investment Program, as well as the distribution of palliatives to Nigerians. The lawmakers also raised concerns over the management of the donations to the fight against the pandemic. However, the Secretary to the Government of the Federation laments the state of Nigeria's health sector.
I can tell you for sure, I never knew that our entire healthcare infrastructure was in the state in which it is until I was appointed to do this work.
Despite the controversy, a 15-man medical team from China have arrived in Nigeria. Members of the medical team were received by the Minister of Health, Dr. Sage Hanire, at the Nnamdi Azikiwe International Airport, Abuja. He explains that the team will be quarantined for 14 days before they're allowed to bring their expertise to bear.
They will be in quarantine for 14 days. They knew that before they came, and they have undergone tests before they left their country. Nevertheless, they will be in quarantine for 14 days. Nigeria NCDC has gone to see where they are supposed to be in quarantine and will continue to pay. They are free to pay visits there throughout the 14 days. So that one is taken care of. But the equipment that has come today, we are very happy to see. The second consignment from China after the Japan consignment. So we believe it will help us a lot in addressing the gaps that we will have had in commodities, and also very important equipment. When you ask how many ventilators you have, we have 50 ventilators more.
The Minister of Science and Technology, Dr. Ogbunnayono, has launched a mobile telemedicine initiative to assist in the provision of medical assistance to Nigerians, especially those at the grassroots. The plan, according to him, is to make healthcare services available to all, especially at a time when the nation is doing all it can to contain the spread of the COVID-19 epidemic.
This facility, providing telemedicine, we can deliver the same medical service, which you can get in Lagos, you can get it in any of our rural areas. So this is the essence of, this promoting this telemedicine.
The federal government has promised to probe the cause of the fire that razed the part of the Accountant General's office. After inspecting the building, the Minister of State for Finance, Budget and National Planning says there is no significant loss in the fire, as most of the documents are online.
As a government, I just want to assure you that our records are intact. A few documents are burnt. We haven't started recovery to check what is burnt or what is not burnt, but all our financial transactions are intact.